Okay, so we're here at the hospital.
So we are in the hospital and it's closed because it's Sunday today. We came here right after the airport.
This bag is not big enough for our stuff.
So they brought us to this office and this is just crazy. Look at that view.
This is life in Turkey, guys.
So this is the doctor. Hi.
How do I say Dr. Sim?
Hussein.
Hussein.
Hussein.
Yeah,
Oh,
a Turkish name.
okay. Are you from Istanbul?
Actually, eastern part of Turkey, but I'm living in Istanbul for a long time. So yeah, I'm from Istanbul actually.
Cool.
Awesome.
Well, this is my first time here.
Yeah.
So we'll start with that device, dermoscope device. Basically, it's kind of a microscope. It will show us your skin and grafts more closely, so we can make a better consideration.
Okay.
First of all, we will check the donor area at the back side of your head, as I said, and then we will go further to your phone line and see the whole area. And after that, we'll decide the other details of the operation. Okay?
Okay.
You can see the screen at the same time with us, and it shows us like half square centimeter area.
Wow.
As you see, your graft quality is generally well, the thickness as well, color seems good. You have some double grafts like that, some triple grafts like that.
Wow.
It's good news for us
That is
actually.
good.
Yeah.
You think his hair color will be the same one with back?
Yeah,
Yeah?
exactly. Yeah, the color won't change after the transplantation. But still you have some weakness in some piece of hairs. You can see them, they cannot grow correctly as the others because they are weak and they are like short.
And we don't want those ones, or?
Actually, we need to support those ones. That's the crown area. You can feel the difference. The number of the healthy hairs are less compared with the donor area. We have still some weaker hairs, some empty spaces. On the midline part, we have the same situation. We have a little bit more empty areas, but for the frontal part, we have huge emptiness.
Wow.
Yeah.
As you see, we don't have any healthy or unhealthy hair, especially on the gulf areas. Just for the front line on the medial part, you have few healthy hairs, but mostly they are empty, as I said. Okay.
Yeah. I've been, I started losing hair when I was 18 years old.
Yeah,
So now it's been 8 years. So
probably you have a genetic predisposition, I think.
probably.
Yeah.
Genetic.
From father or uncle.
Yeah, or uncle, yeah.
Could you hold the mirror, please? Now we'll make an approximate hairline design for you. Final drawing will be done in the operation room tomorrow, but that will be just a sketch to give an idea about the planning of the operation. From your donor area, we will work maximum, but the number of the grafts that we can harvest will be approximately around like 3,000 grafts, maybe more, because just above of your ears are so thin and the lower parts of the donor area is so thin too. So these areas are not so useful right now. We will basically focus on the upper part of the donor area. So the size of the donor area is a little bit small compared with a normal strong donor area. That's why the number of the grafts that we can harvest will be a little bit limited. So could you raise your eyebrows up, sir, as much as you can? When you raise your eyebrows, we can see your forehead muscle, the occipitofrontalis muscle, and that muscle is generally our borders. There are lots of factors that we have to be careful during drawing a hairline, but one of the most important factors is that muscles. Your muscle border is almost like that. Yeah, actually a little bit lower than that, but we need to start a little bit upper because the empty area is really big, and the number of the grafts that we can extract from your donor area is not so enough to cover all. So we need to make the area smaller. Okay. So basically, we will start from that part, and we will implant until that area. Okay. Almost like first 50% of your emptiness. Okay. And 1 year later, after your donor area heals well, we can make another operation for rest of your hair, because as I said, the number of the grafts that you need for that emptiness, for full coverage, is huge, and we cannot harvest that number in one time. So we need to do that within 2 steps. Okay.
Okay.
Let me check your beard too.
I actually expected that.
In some patients, if the beard is strong, we can use these grafts too. with mixing with the donor area. Yeah, your
That's the beard?
grafts are so thick,
Wow.
thicker than
Yeah.
your donor area. So if you want it, we can use these grafts in the same session within that area, so we can increase the density with that way. Okay, and we can harvest maybe like 500 grafts from that part, 400 to 500 grafts, and we will implant them for that area.
What do you think about that?
And
I didn't do any research about donor area here versus here.
Actually,
Are they different results?
Actually, the success ratio is almost similar, but on the frontal area, the chest grafts are not so survivor as like beard and the donor area. It's just an optional. If you want it, we can do that to increase the graft numbers, or we can use on the next time for that purpose for the crown area too.
So you're saying you just do the front but not the middle?
Exactly, because you cannot. If we spread all the grafts to the all empty areas, the density will be so low, and your operation will be meaningless.
Yeah. So if you take some from here and they grow here, will they look different than the ones you take from here?
Actually, we will mix them.
Mix them?
And the number of the grafts that we can harvest from your beard is so small compared with the donor area. So they are not so visible. There are some small difference about the color of the beard right now, but as I said, the amount of the grafts are not so huge, so they won't make so big difference. It doesn't seem weird. Okay.
Yeah. Okay.
We will do your operation with DHI Directed Implantation Pro, and the operation itself will take around like almost 5 hours, maybe a little bit more. We will start with sedation. You will sleep just for 10 minutes, and then we will continue with the local anesthesia. So after first 10 minutes, the effect of the local anesthesia will start, so you won't have any pain during the whole process. First part of the operation will be the harvesting part, and the second part will be the implantation part. After the operation, you will rest for 1 day, and the third day will be your washing day. We will make your first hair wash in here. We will take your bandage off, and then you can continue your normal life. There will be some instructions that you have to be more careful after the operation. For example, you will use 2 antibiotics twice a day for 5 days. It will be a prophylactic treatment to reducing the risk of the infection. Also, you will use some stomach pills to prevent any kind of stomach ache for the first week. Okay. And you will drink much more water than normal for the first week. At the end of until the end of the first month, you will wash your hair every day with a special shampoo and lotion. It will be a special hair wash, as I said, and we will give this shampoo and lotion for you, and we will explain how we use that at the washing session. According to that instructions, you will wash your hair every day. At the end of the first month, the implanted grafts will fall, and with the third month they start to grow up again. We will see the final results around like 6 months to 9 months approximately. Okay. Before the operation for the 2 days, we don't recommend to use alcohol. Also after the operation for 2 weeks, try not to use alcohol. Okay?
2 weeks.
Because it makes bleeding, and that can be harmful for healing process. Okay. Any question about the procedure?
Question about the band. You said bandages. You take them off on the first washing.
Yeah. At the
and
third
don't
day.
put them back on.
Exactly.
Okay. Just be careful about protecting it then.
Actually, for the first 3 weeks are important to protecting them. I mean, don't hit your head anywhere, for example, or when you dry your sweat, for example, don't be so hard. Okay, try to be more gentle. Exactly, with that kind of stuff. And there isn't any problem about the sun or raining, that kind of stuff.
No problem.
No problem. For the 2 weeks, we don't recommend to use hats which is touched directly to the planted area. We will give a special hat for you if you want to use some coverage for your head, and you can use these hats. After 2 weeks, you can start your normal regular hats, but for the first month, you should be more careful when you use it. Okay.
Okay.
That's the details. About the other details of the operation, Mr. Norman will give more detailed explanation for you. and tomorrow we will do your operation. Okay. Before the operation, you should be fasting for 6 hours. You shouldn't eat or drink anything. Okay. Don't forget that.
So tomorrow, 12 o'clock start.
They will text a detailed message from the WhatsApp
Okay.
tonight about the time of the operation.
This is a busy place. Okay.
Damar yolu açacağız PRP için.
Biraz verilmişti. Tamam.
Yazın ben gelirim. This is a laser lecture for 15 minutes and a share view here, and then we'll do the headline. Now we're getting blood from you for the PRP, plasma.
How are you feeling?
Definitely a little nervous.
Nervous? I'm nervous for you too. I have like really fast heartbeat and goosebumps and I don't know. Are you ready? What is this hat they put on you?
That's some laser thing.
You're gonna have hair. Oh my gosh, it was so bloody in that other room. I don't know if I can actually stay for that blood.
Yeah, it's okay if you can't.
What are your expectations? I never talked about it.
So I'm expecting to go to sleep, get the local anesthesia.
You'll only go to sleep for 10 minutes.
Yeah, get the local anesthesia, and then from there, be awake, right?
How are you?
Good, how are you?
I'm Dr. Furkan, your transplant.
Okay. Weird.
Murat çıkış hazırlamadı.
Got the head up on the wall. Could you ask them, is this okay?
Kamera için biraz rahatsız ediyor ona.
Nasıl yani?
Ne için yani soruyor kamerayı?
Kamerayı ben koymam.
Yani size rahatsız edebilir mi?
Ha şöyle, operasyon esnasında kamera zaten yasak hani. Operasyona kadar sıkıntı yok ama anesteziyle uyuttuğumuz zaman kapatırız.
Ha. He said that for the time right now there's no problem. When the surgery is gonna begin, you have to close it.
Okay.
Yani yanlış anlamasın.
Yeah, because it's gonna be too much blood and stuff, so it will be better if you close it.
Okay. And then after I can turn it back on.
Yeah.
Okay. That's fine.
Tamam.
They're gonna right now make the lines so you can see where the surgery, the transplant will start and where to end.
Okay.
Bana doğru dönebilir mi?
Can you look at him? So you can sit towards like him.
Kaşlarını kaldırsın iyice.
Can you make like this? Yeah.
Yok tamam sen şey yap.
You can look right now. So the transplant will start from the back here till the blue line.
Şimdi kas hizasıyla beraber çizeceğimiz en doğal hat bu. Ona
So
göre
he
bir
said that
şekilde.
it's gonna be the most natural for you. So it will be the transplant from here like this till the back of your head.
Şimdi çok kavisli olduğu zaman doğal durmuyor. Çok düz olduğu zaman da bayan hattı gibi oluyor. Onu da söyleyeyim.
So whether you open your eyebrows or you make it down, it will be the same. So this is your natural hairline.
Okay.
Öyle kamerayı
So I know that he'll be taking donor area
From back of your
right?
head. Yeah.
From the back, right?
Alım yeri sadece esneden mi alacaksınız yoksa başka yerden mi
Şöyle
alacaksınız?
bak tam şu noktadan alacağız. Şu hizadan kulak arkasına kadar. Şöyle.
That's all the donate area will be. From the back of your head till you're almost like your ears.
Okay. And
Yes.
do we know roughly how many?
So just a second.
2500 kök
It's gonna be 2,500.
ama şöyle biz ona sabit kalmayacağız. Çıkarsa daha maksimum yani yüksek çalışacağız. Maksimum çalışacağız.
So the minimum could be 2,500, if there's a too much good donated area, they're gonna take more, so they can make it much more graphic in the middle, in the front.
And if he needs to, can he take some from here
Sakaldan alacak
or
mısın?
no?
Yani şöyle kafadan çıkarsa sayı sakala bence çok gerek yok çünkü sakalı sonraki süreçte belki şu tepe bölgesine daha sonrasında tekrar bir ekim yaptırırsa ona saklamakta fayda var. Şu an çünkü ön hatta sakal kökleri çok tutmuyor, çok iyi olmuyor.
He said that the most important and the most perfect donated area will be from the back of your head, but if you take from your beard, it's gonna be not that bad. So it's gonna be a little bit problem because the beard here is different from the back of your head.
How are you feeling?
So I'm pretty much out of my mind right now.
Anesthesia hit
Yeah,
you?
I'm like crossfaded or something. I don't know how to. I can't explain it. It hit me upside the head, and well, they put the anesthesia in, and they said good night, and then I felt like, oh shit, am I gonna fall asleep? So when I actually started falling asleep,
Yeah.
stuff started moving. I started going places. What is this? Something wet on my back,
What?
or maybe my side. I don't know, maybe.
Over here?
Nothing's wet over there?
No.
Okay. Alright, I'm good. I'm good. Okay, we can start right now. Yes, let's go.
So it's 4:30. It's been 2.5 hours since I left.
2.5.
Yeah. And how are you feeling?
Kind of exhausted.
Exhausted?
Hungry.
They gave him something in a little apricot juice. This is how his head looks. There definitely was blood.
There's a ton.
Did it like drip on your face or
Yeah.
did it hurt?
No. It didn't hurt.
How did it feel?
Felt like they were scraping my head.
Really?
Yeah. So I can use the bathroom?
Can you go to the toilet?
Yes.
Yeah, you can.
I'll have more to say once I'm done being
Poked.
poked, stabbed, yeah.
It's okay. It's all worth it, Maya.
Mm-hmm.
Okay, we'll give you an update a little later.
Okay. I feel like shaky, jittery, just because I think the
Anesthesia.
yeah.
Yeah.
anesthesia.
I wanted to show. So they said they extracted 2,700 hairs out of the back of your head, and they're going to cover this whole area where they drew. But they're not covering the crown yet because it's going to be in a year or so, right?
Yeah.
Mm-hmm.
She touching my head.
Yeah.
I don't feel it.
Uh-huh. Wow. It's a big area.
I'm just eating some stuff to get some sugar. But if you look over here, this thing, it's like a giant pad. And multiple of those were like full of blood. Yeah. So, crazy.
It scared you?
Yeah, it was a little bit weird.
You could feel the blood running.
Yeah, I could feel the. Sometimes I could feel the blood like run down my neck or into my eye or splash into my ear.
Oh my God.
Yeah, that was wild.
I'm sorry you had to go through this experience.
We'll see it. We'll see how it turns out. That's why we're doing this vlog, so that we have this captured.
Yeah, and then we'll have to put something in the beginning saying that it has sensitive content. Even though there's not as much blood as you had.
3. ay arası şok
Okay, they're
dökülme
starting
oluyor.
now.
Buralar hani böyle
This is how the
tamamen
grafts work.
çıkmamış gibi görünebilir. Ama toplamda 6. aydan sonra artık hiçbir şey kalmayacak. Yani şöyle söylesem sana, 1 ile 3 ay arası şok dökülme başlar. Bu 1 ile 3.
So there's 3 people here. The doctor is using these little pens to insert, implant the little hairs in, and these people are working really fast. They're putting those little hairs in the pens so that the doctor can be quick. It's been like 2 or 3 more hours already, I don't even know. And they said it's another 40 minutes?
Maybe half hour.
Okay, so
I asked a half an hour ago.
awesome. Okay,
Alright.
how are you feeling?
I'm feeling good.
Yeah, there's very little blood in there.
I know. I'm gonna ask him if it's normal. Little blood.
Yeah, it's normal, I think.
Normal?
Okay, all done.
Yes, that was good.
Wow, it's 7:40.
Yeah.
That's crazy. How are you feeling?
I'm feeling good. A lot better than after the extraction.
Yeah.
Still need some food.
I know you do. You haven't. Last time you ate was at 3 a.m.
No, I ate almonds.
Well, that doesn't count. So they're cleaning you up a little bit, changing the bandages, and then you're free to go.
Welcome to Turkey. Coming to Turkey. Your man, your husband, sweet.
Thank you so much.
Sweet.
Furkan, right?
Yes.
Dr. Furkan.
Thank you.
And what is your name?
Burcu.
Burcu.
Burcu. Beautiful.
Thank you.
Thank you
I
so
hope to
much.
see you again.
İnşallah.
You say you feel better?
I feel good.
Good.
Çekmecede maskemiz vardı. Onu ben yiyorum.
Yeah, you're gonna need a new mask. That one is
Could
all
you-
bloody.
Is it bare? Could you show? Just get it on camera. I just want to see it.
It's really bloody.
Even if you don't post it, I just want to see it. Can you show me?
So she's putting new bandages on. She said that he'll regain his feeling of the skull of the head in 4 hours.
Yeah, my scalp is completely numb.
You don't feel anything she's doing right now?
I feel that she's touching me, but to the touch, I don't have that sense.
Efendim.
Hmm.
Efendim. Kapama yapıyorum. Arayacağım seni.
Tamam ben çıktım evden geliyorum.
Tamam, kapama yapıyorum. Ona göre.
She's putting new bandages on.
I mean the deli. I wanted you to ask her how the deli is.
It's good. I asked her.
Did they make a soup?
I don't know.
The doctor said he was from Kurd something in Turkey.
Oh, cool.
Mm-hmm. And that he has patients from Colorado and California too.
That's awesome.
Yeah.
Now he has one from Connecticut.
Yeah. And maybe we'll get him some from like Massachusetts or somewhere.
Yeah, or Levi
I
will
swear.
come.
Yeah.
Are you ready to go through this again in a year?
Yeah, now that I know, I could be better prepared. And in a year, it won't be as many as this.
Yeah, it will be very little.
So that means less time and Yeah. Honestly, the hardest part about it was the extraction.
Mm-hmm.
And it wasn't even that it was hard, it was just that laying down for so long. It's just
And
not
feeling the
it's not
blood drip.
comfortable. Yeah, it's just not comfortable. So you're just basically uncomfortable all day, which is okay. You could
It's
live,
worth it, right?
Yeah, you could live with it.
You've been bald for 10 years.
I know.
Well, not bald for 10 years, but balding.
Yeah.
Wow, I can actually like imagine you with hair now.
Mm.
So that way they will keep it on file and know exactly what to do in the year, right?
Mhm. I know when we go home, everybody we see will be shocked.
Everybody will be so
I'll
shocked.
just be in the, like, I don't know, should I be in the deli? Maybe not till Monday.
Yeah, you should rest. Just rest. And then they will give you some kind of a hat. Wow.
And could we take this one out?
Oh yeah, you've been sitting with that thing the whole day, huh?
It's okay?
Okay.
Yeah, they kept it in just in case I needed it, but I didn't need it, so it's been off.
So that was the first one, and then that half, more than half, like 2/3 maybe.
Those bags, believe it or not, are pretty expensive.
Really?
Yeah. I don't know about here, but back home, yeah.
How do you know?
I used to work with them when I
Mm.
was in college, and I knew the price then. I forget what it was, but I remember it wasn't like cheap. It was like 500 or something, maybe less.
So yeah, they said they will give you a special hat if you want to,
I do want it.
and then only in like 2 weeks or 3 weeks you will be able to wear regular hats.
I don't want to wear hats.
Yeah, probably shouldn't. But you look good in
I want to
hats.
show my hair.
Yeah, you want her so much for it. My
Well.
gosh, I can't believe. It's so
It was
awesome.
probably harder for you to sit in the plane ride the whole way than it was for me to lay here.
You're awesome, Maya. We're gonna have a big celebration dinner.
This was the best birthday present.
Oh, well, it wasn't really a birthday present.
Yes, it was. Thank you.
Sono. Okay. Careful.
Just need one too. They were really good. Wow. I
Feel
can't
like a
believe it.
person.
I'm standing after the operation.
Wow, look. Go closer and stand like this. I'm gonna get both of them. It's just crazy. Look guys how bald he was and now he's got hair.
Can you see it or is it covered?
No, I can see it. I'll take a picture for you. So they brought us to this room.
This with water?
Yeah, but after the soup.
Oh, okay.
They brought him soup, lentil soup. I had that earlier today and it's really good. Yummy. And then I think this is what they're gonna give us now. Because I saw a lot of guys walking out with bags.
They have such unusual names here. Like, I'm not used to it. Like,
I know,
what was
it's
that?
Turkish name. I don't know, I don't remember.
But something.
I have it on camera.
Yeah. It's really interesting. Wow, this is straight up lentil soup.
Yeah, it's really good.
And this is a painkiller. For now, yes.
Before we go on more, can I just repeat so I think I know?
Everything is written here, sir.
Oh, okay.
No worries.
So every morning,
One of
before
this.
breakfast,
Exactly.
and then after I eat 1 and 1,
Yes.
and then
Every 12 hours.
Exactly.
again later 1 and 1, like before dinner.
Yes.
Okay.
And this is a painkiller, not more than 4 pills a day. In case you feel pain, okay? Not all.
It's not needed if I don't feel.
Exactly, yeah.
And
yes, I can hear you.
there's only 7 here, so just 1 week?
5 days.
Oh,
These
5?
are 5 days. So in case you feel pain today, you can use
Okay.
it. Okay. And these are 2 pillows. You can just fill them with air. Put them on your neck, 1 or 2, up to you, to just have better sleep. And this is a cap. I'm sorry.
It's okay. No, it's okay.
And this cap you just wear it
Cool.
when you go outside.
Love
Yes.
it.
It protects your head from the air, whether or the rain, snow, and sunlight as well.
Thank you so
That's
much.
everything. So if
Okay.
you have any questions, you can hear me.
Okay.
So we also got some kind of a 12-month treatment thing.
Okay, they're gonna be they're gonna be tomorrow or after tomorrow in the washing session.
Okay.
Okay, guys. So we're back in the room after the procedure. What time did we leave the room? 12. We left the room we got picked up by the driver at 12 o'clock. And it's been really cool because they arranged everything. They arranged 5-star hotel with breakfast included. They arranged all the rides for everywhere we need to get to for all of the appointments and everything. And what else did they arrange? They're arranging a year of treatments for my head. And they gave me a guarantee letter that I could go back to them if I ever need to, knock on wood, and they will just do any kind of fix on the house, which is awesome. So now that we're back, I feel super happy. They told me not to look down for like 1 month, but I think what they really mean is like don't stare at the floor for a long period of time. So like I could like look down for a second, but they just want me not to for a little while. Anyways, we're gonna eat now, so I'll show you guys what we got in the bag from the clinic after. And this is the name of the clinic. Check them out online. Yeah, it's 9:15 on Monday, March 15th. And I just had my hair transplant procedure. It was called DHI, or in other words, there's another name for it, CHOI. And it's like the newest, or one of the newest techniques for hair transplants. Anyways, the procedure took from about 1 o'clock till almost 8 o'clock. I'd say more like 7:30. So it was a good 2.5 to 3 hour session of just pure extraction. Yeah, so when we got to the hospital, I'll just start there. When we got to the hospital, we walked in, they brought us in from the driver, brought us to the room, explained anything to us, and asked if we had any questions, and then basically what they explained was how the procedure would go. And the way I see it, it's like 3 stages. The first stage is when they put you down under anesthesia for about 15 minutes. They do that so that they can inject local anesthesia into the donor site, which is where they take the hair from. And in my case was the sides and the back of my head. And they want you under anesthesia for this because I guess it's a pretty good sized needle and it's pretty painful. Yeah, it just hurts. So they did that. That's stage 1, 15 minutes, put you down. You know, they get the needle in your arm, they get the saline, whatever it is, pumping, and then when you're ready, they insert the anesthesia. The guy put it in, he's like, okay, have a good sleep. And I was anticipating it, and I was sitting up in the chair, and like maybe 30 seconds later, I'm out. Except I felt like I was on a trip, to be honest. Like I felt like I was seeing walls folding and going through floors and everything. But when I came to, I was talking like all silly. I was really silly. I don't think we got it on camera, but I was telling them how everything was, I was like moving and I was kind of laughing and they were all laughing and it was really funny. Somehow I started talking about the YouTube channel and one of the people there subscribed to us, which is cool. Anyways, that's stage 1. Stage 2 was lay down after the local anesthesia and the donor site is put in. And basically for a good 2 to 3 hours, it was more like 3 hours, they extract using a specific special pen that's engineered to take out the hair with the follicle before they started taking out the hair from the donor sites, they had to shave my whole head, obviously. Well, I guess it's not obvious, but they shaved my whole head before taking it out. And then I laid down and they started using this special Choi pen. And then they saved on a plate, like a special plate, all the specimens, I guess, all the hairs. They saved them all. But for a good 3 hours, stage 2 was them extracting all of the hairs. And if you see a picture back there, it literally looks like, you know, if you've squeezed out a blackhead before, not to be gross, sorry, but this is all kind of gross. It looks like that, like an empty pore. So if you see a picture of how my head looks after the extraction, it's all empty pores. And it doesn't look damaged at all, which is like really good news, because I was doing research on other techniques like FUE, and there was like a lot of instances where people were left with scarring, and that's what I did not want. So when we found this clinic that did this new technique that really doesn't, or has a really high success rate with no scarring, I was super relieved. So we just pulled the trigger. After stage 2 of extraction, which was like 3 hours, they gave us like 10 to 15 minutes, because I was still coming out of the anesthesia thing. I couldn't eat for 6 hours before getting to the hospital, I think because of the anesthesia. I couldn't have any water at all. So the last time I ate before going to the hospital was actually 3 a.m. because we stayed up all night. We were like jet lagged. And so anyway, we got to the hospital. After part 1 and 2, I came out. I was out of the extraction phase, and I was like super grumpy. She could tell right when she walked in. I had like a pissed off look on my face. It was super, not super hard, but it was just uncomfortable not to eat for so long. And I'm one of the type of people who gets really like angry if they don't eat. So that happened. And then phase 3 is basically they gave me 15 minutes. They gave me juice with some like plum juice, I think, or something with sugar, and then like another sugary snack so that I could get my like blood sugar up. And so they gave me that. They gave me some 10-15 minutes maybe to use the bathroom and just kind of get like situated and get prepared for phase 3. Phase 3 was the easiest thing ever. All they did was take a needle, local anesthesia, and they put some local anesthesia. It was a small needle. I didn't have to be under anesthesia fully for it, so they just did the local anesthesia while I was awake on the top of the head. They did it in like 3 or 4 spots, like 1, 2, 3, 4, so all around where they were going to be inserting the hair follicles. So that brings us to phase 3. It took started at like 5 o'clock and it ended at like 7:30, and they took out 2,700. That's 2,700 grafts from the back of my hair, from the donor site. They took out 2,700 grafts from the donor site. And over the 2.5 hours, I did the math. To put that many grafts in, the doctor had to do at least 18 to like 24 per minute, and just nonstop. So there was 3 people in the room, the doctor, and then another guy who was basically his assistant, who was taking the grafts from the plate. He had gloves on and like a tweezer, and he was taking the graft from the plate and inserting it into this little tiny pen and placing it down, and he was just doing that as fast as he could, and the doctor was taking each one basically and just poking me with it and throwing an empty cartridge away. So every minute he rifled through like 20, like he wasn't going that fast, but he was going pretty fast for a good 2.5 hours, almost 3. And yeah, I mean, I was really comfortable. The guy I was getting the procedure done had done over 2,000 people. I think he said even close to 3,000 or 4,000 people. And yeah, I think it was really good. Right now, it's about an hour and a half since the end of the procedure. The local anesthesia I feel like is wearing off, so I'm feeling a little bit of temperature. Maybe like the top of my head is kind of having a fever, so to speak. Not a fever, but like it's getting hot because I think that the anesthesia is wearing off, and I'm starting to have a little bit of a headache. Before I left, they re-bandaged me up. So in 2 days, you're supposed to go back and get your first washing session. But since we rescheduled our flights to leave earlier because we miss Romy so much, we're actually going to go back tomorrow. They say you have to wait 24 hours at least. So we'll wait 24 hours. We'll get my hair washed tomorrow. They're going to show me exactly how it's done. Apparently it's very easy. And they're going to give me 1 year worth of treatment, including ointment, any bandages, special hats. Yeah, she said she saw some people taking them, and there's a lot of stuff. So really, really, really happy about that. I'm so happy. I can't even express it. Like, anyway, that's it for now. We're gonna eat. I'm probably gonna take a painkiller because my head is starting to have like a headache. It's not like my head hurts. The pain I'm having right now is more like a headache than anything else. I've never...
So it's not the skin?
Yeah, no, it doesn't really feel like the skin. I'm betting that the skin is still a little bit numb, but I'm kind of like having an internal type of headache a little bit, like a normal headache. So I'm gonna just take one probably when I eat, so that like as it wears off, the painkiller kind of like takes over, and then I'll go to bed. Oh, that's another thing. They gave me these 2 blow-up pillows, and I have to sleep on my back, face up, with the pillows on my neck so that I don't like roll over on my hair and mess with the grafts. So yeah, I think I covered pretty much everything. And
what about the staff?
The staff was awesome. They were all very, very nice. All mostly Turkish-speaking people who spoke a little bit of English, but there were some people in there who spoke great English and were able to help. But with the staff that was in there doing the procedure, their English wasn't the best, and my Turkish is horrible. So while we were doing phase 3 of the insertions, I was pulling out my phone, and because it was part of the procedure where I was able to actually have my phone, I was on my back, and I was like translating back and forth with them and talking to them. So they were really, really great. Anyway, shout out to them. I don't know if I should drop names, but Furkan, Bojor, Murat.
So
Really, really awesome people. I really hope we see them again sometime soon, and if not, would love to have them all in America. Okay.
Did you tell them which part of procedure was the hardest for you and which one was?
Yeah, the part of the procedure that was the hardest for me was for sure phase 2, the extraction. It's not that it was painful, but I don't think I was totally prepared for the amount of blood that would be coming out.
No, that's our fault because we didn't do much research. We didn't even watch a YouTube video.
I watched some stuff, but anyway, they didn't really show full out like that. So you have a lot of blood capillaries in the back of your head, and especially me, I have more blood flow back there than up here, which is one of the main reasons those hair follicles came out in the first place. But with the treatment that they're going to give me, the ointments and everything, and like the plan to follow, I should be able to care for these hairs and keep them. That's the idea. That's the goal. But it was phase 2 that was definitely hard. It's not like I was maybe I was in shock. I could have been in shock from the amount of blood, exhausted from jet lag, exhausted from not eating. So
It was a huge stress for your body.
that was just
overall.
a collective stress, and that's why it was so hard. But after the extraction, when I was able to actually start eating and drinking the snacks they gave, I felt so much better, and phase 3 went by like that. It was so easy.
Even though it was like good 5 or 6 hours.
So in other words, I think to avoid that, like, don't go into a procedure jet lagged, because you'll be exhausted. I was up until 5 or 6 a.m. I couldn't fall asleep, and then I slept till 11, and luckily woke up. I had an alarm for 7 o'clock.
Yeah, I didn't even hear that.
It woke me up. I shut it off, but yeah. Anyway, I think this is good enough content for now. Our food's gonna be here any minute, and I'm gonna get ready. We're gonna get ready. So, all right, guys.